Good afternoon, everybody. We're going to get started right about on time. Please note that on the slide in front of you, there's an invitation to go to mentee.com. Use that code there and you'll be able to answer a few questions. We're going to do that activity early in today's webinar. We're glad you're with us. We'll get started right about on time. Good afternoon, everybody. For those of you who are continuing to join the webinar, we're inviting you to go to Mentee.com and use the code 860099 to answer questions. We're going to be going through your answers on the webinar today, and just wanted to give you a heads up. Hi, everybody. My name is Peter Eckert, and I'm at the Illinois Public Health Institute. And together with our partners at the Michigan Public Health Institute, we are the Program Office for Data Across Sectors for Health, commonly known as DASH. My sense is that all or most of you are already pretty familiar with DASH. We will talk a little bit about, for those of you who are still getting up to speed on DASH and All In and all the different kinds of things that we do. Today is really a welcome webinar for those of you in the Mentee program. And it's going to be less interactive than some of our webinars, I have to admit. It's going to be a lot of us talking to you. I still hope that you will, if you have any questions along the way, please ask them. That will be a great way to interrupt the flow of what we're doing, which we're desperate to have happen. And we will kind of pause and encourage you to check in with us and ask questions, any of the questions that come up. So on the call today with the opportunity to speak to you are myself and then Anna Barnes on our team and then Swati Goyal. And so Anna and Swati, Anna, would you like to introduce yourself?
Hi, everyone. I'm Anna Barnes. I'm a Senior Program Manager at the Illinois Public Health Institute.
Hi, everyone. This is Swati. I am a program associate, and I'm the person that you've been receiving all the emails from about your contract. So thank you for getting them back to me.
Also in the room is Susan Martinez, who's helping us out with technical issues today, and she will be a point person in the future for travel reimbursements when that becomes a thing for you. Okay, so we're going to jump right into it, encouraging you as always to ask questions along the way. Really today is about getting an overview of the DASH mentorship program, to hear sort of what we learned in our first round of this, because this is Mentorship 2.0, to understand what our part is from the program office in making your participation be successful, at a much too high level introduction to the other folks who are going to be on your cohorts and in the program overall. And then we'll spend a little bit of time talking about all-in data for community health. So as I said, this is the second trip around the sun for the DASH mentorship program. Version 1.0 was pretty much a thrilling success. And so we built on that to come up with these purposes. Number one of which is really to help you do some multi-sector collaboration and move towards data sharing. Along these kind of 6 bullets, we're really about connecting you to others who can collaborate with you and connect you to national leaders, especially your selected mentor. We've created a learning community where you can be connected with other folks who are tackling questions and opportunities like the ones that you're facing. We will, some of you will be traveling for in-person meetings, and we hope that a lot of you will be able to take advantage of that. You will have 10 months of mentorship time to explore, experiment, plan, and even execute a data sharing project. You're going to also be doing a lot of this work within the all-in community, and we'll talk about that. And then when I talk about the DASH Phase 3, I just really want to represent that even though your funding is small and there are a lot of you that are a part of this. We really see you as partners in our long-term vision for executing what DASH is trying to do nationwide. So these are the mentors. These are the same mentors that you probably remember hearing from during the mentorship pitch meeting that we had, where all of you were introduced to the idea of the mentors. I won't read from this slide since we're going to go through and meet virtually all of them in a few moments. We did, all of the mentors have state, regional, and national reputations, and they all do a bunch of different things. But we selected these set of mentors because they all have expertise and experience with topic areas that matter to us in terms of building the field, and especially in terms of our work trying to build up community capacity for collaboration and data sharing. And so I guess I want to recognize that because really the mentors are extraordinary. Corporation Support of Housing obviously works on housing. CORE is located inside of a health system, and they have a really interesting set of experiences related to community and healthcare based research. The Civic Canopy in Denver, Colorado is really about community engagement. The University of Pittsburgh work revolves around civic data intermediation. Elevate Health is working on a really comprehensive model for long-term sustainability and community engagement. San Diego 211 is your source for all things related to community information exchange, and the United Way Worldwide is worldwide and nationwide around 211 and engagement with community-based social services. So you will get to know, obviously, your own mentor very well. But one of the reasons why we're doing this webinar at this point is that we were told after the first round of mentorships that the mentees were all thrilled with the mentors that they had, but they knew that there were other important things happening in the other mentorships. So we're trying right now to set the stage so that you know who else is involved, so that when it comes time, you'll be able to reach out to other folks, even if they are not a part of your mentorship. So what I want to do now is send control over to Swati, who has been actually you can just take it back. Who has been compiling the results of the Mentimeter survey, and so she's going to show that on the screen in a second. Beautiful. All right, and so we are still waiting because right now it looks like there's absolutely no information. Hang tight. Here it goes. I'm not seeing it either. There we go. Okay, little lag time, everybody. And also, I want to recognize as we move forward today that normally this would be Anna Barnes leading this. Anna really the team lead on the mentor program. So many of you have already engaged with her. She was unable to be in the office today, so she's on the call. And so if you hear any cracks in our armor, that's all me. happy to provide a little levity on a Friday afternoon. So this is who you are as you are identifying yourself. The thing I want to call out on this slide is that community-based social services, social and human services, is the #1 representative here. And this is really important for us because one of the things that we've been doing with DASH is we have always been about the sectors that contribute to health that are beyond simply healthcare and public health. And that's always been our focus, to work with organizations that are trying to understand and apply social determinants. But this focus now, and the mentorship allows us to do this especially, is to really bring in a new focus on human and social services. So the fact that human social services is so prominently represented in the membership here, I think is really terrific, especially since you recognize that CBO is a whole nother category. So public health is here, philanthropy is here, healthcare is here. What is philanthropy? That's interesting. I wonder who those folks are. Community development and something else. And so that's for all the folks who your friends say, oh man, those folks, they are something else. Next question. So we also asked you how you would define the location of your organization. You are all feeling this in as we go through it. This is interesting to us. One of the great things about the mentorship program is because we're able to do so many mentees, we're able to hit some locations that we're not always great at hitting. So just thrilled to have such a strong rural part of this, because multi-sector data sharing tends to happen more in places where they have more capacity, so urban and suburban, but this is great. Next up. So where are you from? This is also really exciting. This is, I don't think we have a slide this time that shows everybody that we funded in the past, but we have been missing in the Southeast. And so that's really great. We specifically were looking for communities. So the Southeast and the Southwest and the Plains, those are three places where we haven't always had a lot of participation in DASH programming. So this is great. Of course, everybody else we're, of course, thrilled to have you too, but those three regions have been lacking. So it's wonderful that we're starting to fill out our map as you go. Yep. All right, and so there's a lot of stuff here about 1 to 3 goals you'd like to accomplish by the mentorship. We will, I'm not going to try to read this. Oh, wait a second. Help my cohort make their hopes and dreams come true, or at least help get them started. I could make a guess at which mentor wrote that, but I'm not going to, because I think it's probably true about all of the mentors. So let's keep going. We will share this information in the online community so that you can see what else. And then what excites you most about being in the mentorship program? We must have, do we not have some answers yet? If we pause, we unpause the scroll. All right, you're probably still getting there. How many more questions do we have, Swati? Oh, there we go. Hold on. This nice thing about having 75 people on the call, we can fill some of these in pretty quickly. So just going to call out a couple. Learning from people who have done this work already. Learning from around the country. Learning from others. This is, as you guys have figured out, this is what the mentorship is about. It's a learning collaboration, and it's learning from and with a bunch of people. I know my colleagues on the DASH team get tired of hearing me say this, but we really believe that the wisdom is in the room. And so for this project, we've got a really nice conference center with 7 different rooms, and each of those rooms has a bunch of really great people. Learning from others, learning with peers, seeing other models. Yeah, you guys get it. You know what we're doing here. Okay, this is really interesting. We're not going to talk too much about equity because this is going to be an ongoing feature of our work. But, when we were doing the application this year for the mentorship program, we asked you to talk about kind of where you were on the equity spectrum. And so I know a lot of you are already talking about it. Some of it you have started to build equity into your work. You're trying to apply an equity lens. You're looking at the far upstream effect of things like racism, sexism, and inequality. It's really great. This is really going to be something that we're going to be talking a lot about. And from a DASH perspective, certainly, but I think your mentors will get to that too. All right, that's terrific. Let me take back control of the webinar. Try to show my screen, see if I can do that in a way that makes sense. Can you send me the ability? There we go. All right. So we are going to now, we're going to meet the mentors and we're going to meet the cohorts. And there is just no way of saying this except for I'm just be doing a bunch of reading stuff on your screen. And I'm sorry about that because of the relatively short amount of time we've got. We're really just kind of rush through this. I do want to say if you have questions, then I think that that we'll get them as you start to ask them in the question thing. I know that the first question we always get is, will the slides be available? Absolutely, they will be. And really, this is the reason why. It's because Swati and Anna asked for fun facts from each of the mentors. So a lot of you chose your mentors already because they're amazing subject matter experts, but they're also fun. And we can say, based on the mentor meetup that we had last month, they are fun. This is a group of folks, and if you haven't had your first call or webinar with them, you're really in for a treat. These are some creative and dedicated people, and I'm really thrilled that they're a part of our DASH activity. So Bob Graddick is at the University of Pittsburgh. I'm not going to read their fun fact. You can figure out why he was nominated for Father of the Year. And Martella McGuire from the Corporation for Supportive Housing is a film buff. So this is Bob's cohort, and I'm probably not going to read these. I do want to use this as a moment to say, near the end of the webinar, we're going to talk a little bit about the online community. And Swati has created documents that describe all of the mentorships. So it has a list of each one of these. So I will say for the Pitt cohort, Richmond, Delaware, Oregon, UT Health, and San Antonio Metro Health, there are descriptions of each one of these 5 collaborative organizations, institutions. And so if you're interested, if you're in this cohort and you want to see information about who else is there, you can do that at the online community. If you are in one of the other cohorts and you want to know more about what these folks are doing, then you will be able to find information about them at the online community. And when we get to the online community, I'll talk to you about how to join if you have not done so already. So for the Corporation for Supportive Housing cohort, they'll be working on housing and health activities this year. We're spanning, this is so great. You guys are all over the place. I just love this. Iowa, Washington, Colorado, Texas, and Yakima, Washington. And so those folks will all be working on health and housing together. All right, in the Civic Canopy, which is located in Denver, Colorado, the mentorship will be managed by Bill Fulton and Kaylee McMonigal. Kaylee was able to join us for the mentor meetup, and that was totally fun. In the Civic Canopy cohort are folks from Billings, Montana, Greenwood, South Carolina, Elk Ridge, is that Maryland? Or, yes, it's covered up on my screen a little bit. Ithaca, New York, and Daytona Beach, Florida. I mean, that sounds to me like that would be like a great 5-stop vacation road trip. So anyway, those folks will all be working on local community building activities together. All right. The group from CORE will be led by Hannah Cohen-Klein and Stacy DeLong. Stacy, who simply loves karaoke. That's really all you need to know about her. The core cohort is located in Milwaukee, Los Angeles, Houston, South Burlington, and then the state of Kentucky. And all those folks will be working on research questions that they proposed and will further refine with the team from CORE. Next up is the folks from Elevate Health, formerly known as the Tacoma Pierce Accountable Community of Health. I'm sorry, Alicia and Kimberly, if I got that wrong. Alicia was able to join us for the mentor meetup and is still the entrepreneur that she was when she started when she was 13. Oh my gosh, Kimberly skydives. That's totally amazing. Folks who are in that cohort are really going to hear that story. So the thing I love about this cohort is that Generate Health is together with Elevate Health. So I think there's going to be a lot of really raising of health there with that pair. Also, Andover, Charlotte, Boise, and Miami are represented in that cohort. This is a great place for me to say the United Way actually recognized that that Elevate Health and United Way Worldwide are both our two new mentors this year, and United Way did a great job of getting the word out to their membership, and so there's a number of United Ways that are a part of different cohorts, in addition to the United Ways that make up the United Way cohort itself. These are our friends out in San Diego. They've got 3 staff people because they actually have a double mentorship. Beth, Karis, and Cami, if you're not already signed up for their national CIE Summit, that's coming up next month. That's a great event. So they have a double mentorship, and so it's all those people right there. I mean, they could probably have their own outpost of Dash out in San Diego, given how much work we do with them. They're great, and these folks will have a lot of fun in their mentorship with a very specific use case of investigating whether CIE makes sense in these 10 communities. And then finally, the last mentorship and one of the 2 new ones. Okay, Edwin, I would have liked to known this when you were here for the mentor meetup, if your band is good enough to play at South by Southwest. Oh, and Megan, we didn't talk about baseball. Oh, that was a big mistake on my part. So anyway, United Way did a wonderful job of getting the word out to their constituents, and they've got 7 different United Ways working on very United Way stuff. So this is the part where I'm going to talk about Dash. If you've already heard this, there's a little bit of new information, so don't snooze on us just yet. Dash, as I said when we started off, is a program office of the Robert Wood Johnson Foundation, created in a real authentic partnership by the Michigan Public Health Institute and the Illinois Public Health Institute. One of the things that we say when we talk about that is that we've been doing this for now over 5 years. And one of the things that we say is that we know about collaborations because we are a collaboration. And so when you talk to us about the struggles that you have in making collaborations work and how you have to compromise and you have to share, whoa, we know what we're talking about because we've got the same issues in our program office. We have said for the last 5 years that Dash really does 3 things. We've got 3 strategies. We build local capacity, we build the evidence base for this work, and we build the national movement for it. So there are ways in which all of your projects hit all 3 of these pieces. We are hopefully in your mentorships building your capacity to do multi-sector collaboration and data sharing. As you work with and report to and do a little bit of reporting with us, we are going to be building the evidence base. And then, look at that. We've added over 50 new communities to the All-In Network. That's the place we're trying to build. The thing that's new for Dash Phase 3, which we started last week, 2 weeks ago, for our next 2.5 years, we're going to continue on those 3 strategies. So those are still going to be core activities for us. But we're also going to be using those different strategies to really start to look at policy and systems change. You know, we're really proud of the fact that over our first 5 years, we've helped over 100 communities with our Dash funding. But that is nothing compared to the needs and opportunities that exist across the country. So we know that if we want to help to change the conditions for community health improvement, we've got to start acting at a policy and systems level. And so when I talk about how you all can contribute to the Dash work, these are questions that we're going to be asking. Obviously, with a $5,000 grant for your staff time, you're not probably going to be moving any policy levers. But I know that some of you are interested in that work and have some experience on that in the way that you do not necessarily this project, but others. And we'll want to follow up with you on that, because that kind of thing is really important to us. I like to show this slide because it tells you how we think about this work. And it's especially important because the mentorship program kind of fills a gap from when we started. We started with some pretty big grants, and so most of them were urban, all of them were housed either in public health or in healthcare. And what we have come to recognize is that all community data sharing starts with authentic collaborations. And so the kind of things that all of you are in or are working to create. And so, you know, as collaborations form out of things where they have a shared value across the collaboration. Then once they've established that they have a shared value, then they can start to do the development of systems. And hopefully that becomes a shared data system. Then those same community actors use the data from those shared systems to move into action. They create programs, interventions, policy work, all that stuff is shared action. And then at the furthest reach on this, they start to move to alignment. Alignment has a specific meaning in the Robert Wood Johnson world, which you will hear more about as we move through the mentorship year. I just wanted to kind of cite this. You all are in our funding programs now. You are part of the Dash mentorships. We have our original grantees. We also have a program called Kickstart that has larger grants, and then we have the mentorships. So I want to talk real quickly. I'm not going to show all the slides because I do want to make sure that we have some time to get to questions. You know, when we talk about this work, we really talk about 2 different kind of use cases. So for those of you who are not familiar with use case language, what it really means is that there's 2 kinds of projects that use shared data. And one kind are where you do place-based community health. This is stuff that often is led by public health or in public health coalitions. It's population health. It's not about individual data. It's about data sets that describe communities. And so the example that we like to use is one of our original grantees for Dash, where the Baltimore City Health Department did a multi-sector database that pulled in data from a whole bunch of different places to try to identify where were seniors falling, so that by identifying that, they could then create interventions with their community partners to try to reduce the falls for elderly. The second kind of use case that we think about is around whole person care coordination. And so another one of our original Dash grantees was the Parkland Center for Clinical Innovation, where they create a partnership between the local food bank and local food pantries with Parkland's safety net hospital. And so they built up a way so that folks who would come into the hospital who were food insecure could be connected to food pantries. And people who came into food pantries and had specific health concerns could be matched up with food that was responsive to their conditions. And so this is a kind of a use case where it's important to know who the individual people are. So that's kind of our two kinds of use cases. In the slides, we have a bunch more examples, but I'm actually going to jump over them because I want to get to talking about what we learned from our first round of mentors and mentorships. And for that, I'm going to turn it over to Swati Goyal.
Hi, everyone. So last year, our mentees they filled out a midpoint and an endpoint survey for their round, and then I'm going to take a moment to present and talk about and pull out some of the things that we learned from those surveys. So one of the questions we asked is what they liked best about the mentorship programs, and I'm not going to go through the entire graph, but just saying that the availability of mentors, having different resources, and mentors being able to share their knowledge and experience was really valuable for all of our mentees last year. Then the second question we asked was list 1 to 3 actions you have taken as a result of participating in the mentor program from May to October. So the reason we asked this question was just to get a gauge between when they took the midpoint survey to the end of their mentorship. What action steps did they take? Did they feel like they were equipped with the knowledge that they were gaining from their mentors? And some of those action steps are quality improvement, engagement strategies, and data sharing capacity. And then another question that we asked is, what's one thing you like the least or would like to see changed in the future? And so part of the reason we asked this question and part of the reason why we're doing this webinar today is because of those responses. So more expectations of the mentees from the mentors, but also more engagement from the program office. I'll give a quick 2 examples of a few of our mentees from each of our mentor cohorts last year. So United Way of Missoula County, they were a mentee of the core team, and they were able to identify their action steps, but then also express that they were very confident in taking in their action steps. Next slide. Cool. Eau Claire City County Health, they were a part of UPIT's mentorship, Bob Gradick's mentorship. And again, they also felt very confident in taking their action steps, and they found that it was really appreciated about their resources and tools and Bob's webinars that helped them get to their next steps. So quick takeaways, we talked about this among our staff here at the Dash PO office, but then also among the mentors. On the Dash side of things, we will be able to build a better visibility of the mentor program and be able to communicate with the mentee cohort at large. Host an all-in 101 kickoff and wrap-up webinar for all the mentees, and we do have. I'll take a moment to plug that we will have 2 all-in webinars that will set the stage for you all in March. And for the mentors, they'll work with the mentees to create a high-level work plan, so we can also be helpful in tracking your progress as the year goes on, and schedule activities such as webinars, check-ins, as well as considering partnering with other mentors to enrich opportunities for peer-to-peer connections and also to be able to gain knowledge from other mentors.
Thanks, Swati. Before we start now talking about Mentorship 2.0, I want to check in and ask Anna, who has been listening along with everybody, if she has anything that she wants to make sure we add right now.
No, I think this is on track.
All right. Thank you, Anna. I do know, I'm sorry that I didn't say this early, we will make the slides available. We made a couple of changes right before we kicked this off and didn't have time to put it into the webinar, but we'll make them available on the online community as quickly as we can after we're done. So I want to talk a little bit about the expectations that we have for you. And there are some of this stuff is about your relationship to us in the Dash program office, and some of it is about your relationship to your mentors. Your primary relationship will be with your mentors, but you all are doing such interesting things. We want to make sure that we have a chance to learn from you over the course of the whole year. So you will have Mentee cohort webinars. And also, if Anna were here, she would have said, remind everybody that all the mentorships are different. And so we'll talk about sort of what that looks like in a second. But just a reminder that the mentorships, they'll have different schedules and they'll have different activities. And so everything that I say right now is about sort of a general anticipation of what you'll get. So, but there'll be some kind of cohort webinars at the mentor meetup. Folks were talking about trying to work with video because that's more engaging. You will be asked to complete a high-level work plan with 2 goals and a set of related activities. I believe that work plan template is already in the online community. We'll talk about that in a second. As a part of your ongoing work with your mentor, you'll be documenting your progress and barriers. Here's the good news. We know nothing in this world goes as planned or as quickly as you hope it will. Really, when we say that we want to learn along with you, we absolutely do. And that even means places where what you're trying to do, you would consider a failure. For us, it's more data and knowledge to share, although we won't call you out individually. You'll have individual check-in calls with your mentors that you'll negotiate with them. There will be action periods called out where everybody will be expected to do stuff. If it makes sense and if it's organized, you'll be able to attend an in-person meeting or a national conference. We will ask you to do some reporting, but that's mainly about evaluation. And then this is an important piece. We know that community activities are fluid, and so if there is a change in personnel associated with your menteeship, please let us know as soon as possible. It's a relatively short time, but there still is possibility for changes. Anticipate if you've got questions about any of those, go ahead and type them into the question box. So this is an example of what I was talking about a second ago, where we have a really general idea of the timeline. This is actually a document that we created for the mentor meetup that we had. Was it January? Yeah, this is February. Okay, so last month. And so we just kind of sketched out, what the program office is responsible for, what the mentor will be doing, and then what the mentees will be doing in that same time. And so this is the reason why we haven't shared this out with you is because all of the mentorship will be different. So I don't want to disseminate information that isn't true for your particular experience. But I do want you to see that in these 2 slides that cover until the end of the period, there's a lot of activity planned. The mentors have a really good idea of what they're doing. I keep referring to this mentor meetup that we had last month. That was a great event, and all of the mentors left knowing, having a much better idea about how they're going to execute their mentorship. They learned a lot from what they did last year, so it was great. I mean, as good as the Mentor 1.0 mentees had it, I think you folks have it that much better. So this is the work plan template. You see, it's super simple. We want to create something that makes it as easy as possible for you to share with your mentor and with us what you're going to be working on this year. There is information about the use of the budget that I want to be clear is that we know it's a relatively small amount of money. We want to recognize that your staff time is valuable, and we want to recognize that in order to execute your project, you will need time to do it. And so that's really why the mentorship isn't just an invitation to participate with the mentor, we do want to allow for some money. The way most of you should have experienced this by now, that we sent out or are sending out the $4,000 of the $5,000 as quickly as we can after we have your signed agreement, and then the last $1,000 will be paid within 30 business days after we get your final report. So this is a big slide for this late in the set of slides. I wanted you to understand that we have a way that we think about this work that we have evolved over the course of the last 5 years. It's called the DASH framework, and if you see up the top, everything that we're doing is trying to be driven towards community health, well-being, and equity. And so the 2 use cases that I talked about earlier, the whole person systems of care, also known as care coordination, and total population community-wide health and well-being. That's where those 2 use cases are represented. And then in the part below that, we just have in the bullets some of the things we think are relevant to what works and what doesn't for multi-sector collaboration and data sharing. So I show you that not because you're going to memorize that today, but because that framework is the basis for evaluations that we're going to be doing. And so sometime in March, we'll be setting out a short set of questions to establish a baseline for kind of where you and your project are. And then we're going to do 2 more surveys. And so these are the 3 times that you'll hear from the program office related to your work. And this stuff is really important to us because it really helps us to understand what's happening out in your communities. Obviously, your mentors will know quite a bit, but for us, we'll know you best through these responses in the evaluation. So we'll look forward to your participation in that. The other piece that is happening is that we're going to be doing we'll be doing this spring our second version of the All-In National Inventory, which is a subset of questions from our capacity assessment that try to understand where the action is across the country for multi-sector collaboration and data sharing. And so we ask questions about the organization that is leading the collaboration. We ask questions about the collaboration itself, and then we ask about the capacity to share data. So that's something that we will ask you to participate in as well. All right, Swati, I think you're talking about the all-in. No, I'm talking about the all-in data for community health. What am I talking about? That's not Swati, that's me. I'm going to do this really quickly, not because it isn't supremely important, but I want to make sure we've got some time for questions, and you're going to tee those up for me. All-In, Dash co-founded All-In about 4 years ago, pretty soon after we started our work, because we recognized that other people were doing similar work. And so in the same way that the Dash program office is a collaboration, we really wanted to align ourselves with other folks who are doing this kind of work, who are supporting this kind of work. And so at that point, Academy Health in DC had created their community health peer learning program, which was so similar to Dash. And so that's where it started. And so right now we have 7 different program partners. They're listed there in the bottom of the slide. It says 150 community collaborations are all in. That's really a slide from last year. Now we're really over 200. The all in is really the home for all of Dash programming, Dash's learning collaboration programming. And so that's the home for webinars, newsletters. We run our in-person meetings through there, and we also do the online platform. That's the piece that I want to quickly tell you about because the online platform is the place where where you are going to be getting information about your different mentorships. It's where all of the materials will be stored, and that's really it's a great virtual community. The link to it is on the screen right now, community.allindata.org. And if you haven't already joined All In, you can do so filling out a form there. And then once you have joined, then you can join the Dash Mentorship community. And so that's a screenshot that Swati grabbed just about an hour ago. And what happens there is that there are places to share files. There's a place to have discussion groups. There's a library of resources that we're going to be building out. And we've already got 39 members. So that is just terrific. So the enticement for you to go to the mentorship community is that Swati has posted small descriptions of all of you in the community. And if you are interested in any of the other mentorships or interested in starting to get to know the other communities in your mentorship, that basic information is available to you in the Dash Mentorship 2.0 community. I would recommend, and I'm going to do this as soon as the webinar is over, to go over there if you haven't yet, and just make a short post introducing yourself to others. It's really it's a good place. I don't want to oversell the online community because it's like a lot of online communities, but it certainly is a dynamic place for us, and we try to use it as much as we can. I think Anna had a couple other slides in there that I wanted to make sure I didn't miss. Within All In, you will have the opportunity to present at national meetings. So we sponsor a lot of people to travel, and we do that when we see opportunities where what our grantees and mentees are doing matches up with the particular information that's requested by a particular conference. And so we're very interested in getting to know what you're doing, because we might ask you to contribute to an abstract to present at a national or regional meeting. We are considering in-person meetings of the mentees. I happen to know that all or most of the mentees for San Diego 211 are going to be at the 211's the CIE Summit. I think the United Way will be there as well. And so that's the kind of thing that we will work on. Within the online community, there's the mentor group itself, and then we also are starting this year a bunch of affinity groups, and those are where there are people who have something in common and want to leverage that for relationship building, peer support. And so we currently have affinity groups for people who are addressing the legal barriers. Off the top of my head, what are some of the other ones that we've been building? We have had one in the past for public health. We're going to have health and housing. So that's driven primarily by the interest of different folks who are in the community, and so you'll be able to do that. Plus, and we'll want to tell your story as it develops, and so we have webinars, we have publications. If you're a podcast person, maybe you can come and be interviewed on our podcast. I happen to know the host of it, and he's really a welcoming guide. Yeah, it's me. Okay, so I think we're near the end we're getting to the end of the slides. Anna has pulled together this list of really great resources to get started. It'll be in the slides when we post them. Just encourage you to take a look. A lot of people, these are responses to questions we get a lot about electronic health data and how to start that conversation about sharing data in your community. That's the Dash value proposition. A lot of information on legal stuff because of our partnership with the Network for Public Health Law. We wrote a really interesting Healthcare Data 101 for those of you who are not in healthcare. San Diego 211 has their community information kit. Just a lot of different resources. This is just the tip of the iceberg. But we want you to know that there's a lot of information available to us. And as you start to develop questions about things that you need, you let us know and we help you find it. If you are going to be at the CIE Summit in March, you can register and join us and come to a pre-conference on the morning before the meeting starts. I think it's free for us, right? All right. Wow. I talked a lot. We still have 6 minutes for questions. Swati, what questions do we have that we haven't answered? None. We have no questions that we haven't answered in line already. And that's because I'm sure that Swati and Anna have been answering a lot of them. Feel free to quickly put any questions either in the chat or to see if you, in the chat or in the questions. All right. I know we have a last next step slides, and Swati, do you just want to run through that, and we'll give people a last chance to ask any other questions?
Sure. So next steps with the program office is doing a baseline survey that was mentioned earlier in the webinar, and we'll have more details about that. Any questions or concerns about the contract? I've pretty much received all of the contracts from everyone, but if there are still any questions, feel free to email me. With your mentors, some of you have already met with your mentors or are scheduled to meet with your mentors. You'll have your check-in calls, you'll have your kickoff call with the mentors. You'll work with your mentors to identify the team members that are on your team, and as well as being able to request any peer-to-peer connections you want to make, want to learn a little bit more about the mentees that are in the cohort. So those are our next steps, and then with each other and then all in, we may do another cohort webinar, and we'll gauge interest for that as the year continues. And again, any meetups or connections you want to make with the mentees or even with other mentors, you're welcome to bring that up. We encourage it in the platform, so using the platform as a way to make connections, learn more about each other. But of course, for whatever reason, if you do need us to step in from the Dash PO side or from your mentors, that would be an option as well.
Yeah, and by the way, if we do another one of these, it's not going to be us just talking at you the whole time. But we had a bunch of stuff we had to get through. So while I appreciate your patience, we only lost 3 of you over the course of, actually, we didn't lose any of you. You're all still here. We lost 3 of your colleagues. So I guess I just want to close with a thank you. We appreciate your interest and your attendance. Feel free to follow up with questions for Swati and Anna, or me if you'd like. Again, I just want to thank you for your interest in the program. I want to thank again the mentors who are amazing. And I'm really looking forward to what you all are going to do together this year. And so I'm sure that we'll be talking and seeing each other in a lot of different places. So take care, everybody. Enjoy the end of your workday and your weekend, and we'll look forward to seeing what's next. Thanks, Anna. Thanks, Swati.